Hello everyone! Before we start, I'd like to introduce myself briefly. My name is Fina, and I am a veterinary medicine student at Udayana University. Today, I will be talking about the obesity in pets and how to prevent it. Okay, first of all, the general definition of pet obesity is when your pet has too much body fat and it has a negative impact for their health, welfare, and quality of life. Obesity in pets occurs when excessive adipose tissue accumulates in the body and is generally defined as occurring when an animal's body weight is at least 20% greater than its optimal body weight. Obesity is associated with metabolic and hormonal changes. Pet obesity can cause serious health problems and make existing problems worse, which can reduce the length and quality of your pet's life. It puts them at the greater risk of conditions such as diabetes, heart disease, respiratory distress, high blood pressure, or even cancers. That's why managing our pet's weight is very important. Okay, next, these are causes of obesity in pets. Obesity in pets usually due to excessive food intake or lack of physical exercise. For example, overfeeding. Overfeeding is providing more calories than the pet's body requires. Then lack of exercise, insufficient physical activity and exercise, genetics, some breeds may be more prone to obesity. And then age, older pets may have a slower metabolism and reduced activity levels. Then medical condition. Certain health issues such as hypothyroidism can contribute to weight gain. There is two ways to recognize obesity in pets. First, body condition score or BCS. Veterinarians use BCS systems to assess a pet's body composition and determine if they are underweight, at an ideal weight, or overweight. Second, visual and physical examination. Look for signs such as lack of a defined waist, a distended abdomen, and difficulty filling the ribs. For example, for dogs, an ideally condition should have a tapered waist when viewed from above and a clear abdominal tuck when viewed from the side. Ribs should not be visible, but ribs should be easily palpated with only a very thin layer of fat cover. Ideally, conditioned cats will have a waist that can be observed behind their ribs, a slight fat pad over their ribs, and a minimal abdominal fat pad with no abdominal tuck. Okay, now let's move on to prevention and management to pets obesity. First, balanced diet. Feed a nutritionally balanced diet appropriate for the pet's age, breed, and health status. Second, portion control. Measure food portions to prevent overfeeding. Third, regular exercise. Establish and maintain a consistent exercise routine considering the pet's species and individual needs. Fourth, veterinary checkups. Schedule regular veterinary visits to monitor weight and overall health. Fifth, weight management plans. If a pet is already overweight, work with a veterinarian to develop a customized weight loss plan. Sixth, behavioral consideration. Address any behavioral issues that may contribute to overeating, such as boredom or anxiety. 7. Treats and snacks. Be mindful for treats calories and choose healthy options or treats in moderation. If you suspect your pet is overweight or if you are concerned about their weight, it's essential to consult with a veterinarian. A vet can provide guidance on a suitable diet, recommend an appropriate exercise plan, and monitor your pet's progress over time. Okay, we shouldn't let our lack of action and inattention affect the ones that truly depend on us the most, our cherished pets. We simply need to have the awareness and the motivation to act. Hopefully, the motivation of having a happy and healthy pet is enough. That's all from me. Thank you for the attention.